I'm Laurie Meininger, Executive Director of Shanta Foundation, and I wanted to take a couple moments to update you on how Shanta and our team in Myanmar is working through the COVID-19 pandemic. But first, let me say that I hope that this finds you and your family well. Our U.S.-based staff, our board of directors, and our team in Myanmar and our families are all, fortunately, doing well. And just like you, we are sheltering in place. These are indeed challenging times. Travel in Myanmar has been suspended. Villages have been stepping up to meet the challenge by creating their own quarantine areas, whether it's a bamboo thatched hut or taking over one of the preschools or school buildings that Shanta has helped to construct in a community. Communities have also identified health educators or points of contact to help them access medical services in the event that they need those during this time. Our staff is having to come up with creative ways to stay engaged when we're unable to meet in large gatherings as our normal habit. They're coaching from long distance. Village leaders are still engaged in community banks, loaning money to those in need. Unfortunately, pig farmers are still able to tend their pigs, and we look forward to farmers being able to plant their crops in the next few weeks so that a few months from now, they'll have the income that they so desperately need. We know that testing is lagging behind in Myanmar, and as isolated as our villages are, it's inevitable that the crisis will reach them in ways that we might not even be able to anticipate for the moment. What's also true is that as we work through this crisis, we're working on this together. We thank you for your support as we work through this, and know that together we have always been and will always be stronger. In fact, it's those partnerships between our supporters, between our organization and our team and the villagers that in fact have been the harbinger of hope for more than a decade in Myanmar. So we thank you for staying with us through this crisis. We wish you and your family good health. Please take care of yourselves as we continue to care for the partnerships that we have with 24 villages in Myanmar. Thank you, take good care, and we'll see you on the other side of this.